Welcome back. Every day we're learning more about the coronavirus, how it is spread, and what we need to do to stay safe. We're talking live now with a pair of experts. First, Dr. Anyimadu. He's an infectious disease consultant with the Hospital of Central Connecticut, and he joins us live from Hartford HealthCare studios. Doctor, thank you for joining us.
Thank you, Lisa, for having me.
You're so key to what we're doing now, what we're dealing with. So first, as an infectious disease specialist, what are your thoughts in general on where we are right now, how it's being handled, and the response to coronavirus in Connecticut, Doctor?
I think we're doing very well so far in Connecticut, and we're working very hard to keep this virus, to mitigate this virus. So currently there are about 26 cases in Connecticut. And in the U.S. right now, there's about 3,774 cases in the U.S. And already we've seen 69 people dead from this disease. So it's not something to take lightly.
Absolutely not. Now, doctor, why is coronavirus transmitted more easily than seasonal flu?
So that's a very good question. That's an interesting question. So we know that with coronavirus, there are some people that are asymptomatic that can transmit the disease. And there are people that are mildly ill too that can transmit the disease. So the disease can spread very quickly, and it can spread very quickly among populations. It can grow very exponentially. So epidemiologists normally will calculate something that they call R0, or basic reproductive number. And the R0 for influenza is about 1.0, but the R0 for coronavirus is about 1.25 to 2.5. So that means that this virus can spread. If someone walks into a place with the virus, they can spread it very quickly, as opposed to how the flu will spread amongst people. So that's why it's very important that we work very fast to mitigate this virus.
And that was my next question. I was going to ask if you are happy to see these measures that states and municipalities are taking to limit people, to close certain places where people congregate. You like all this that we're doing right now?
I think so far we're doing a very good job because, it's, as I said earlier, this virus can really spread very fast. And what we don't want is to see the virus infecting so many people such that our health systems will break down and we wouldn't have the capability to take care of all these patients. So closing down schools, closing down institutions is a very good way to mitigate the virus. And I think we should all try and work together to stop this virus, because now there's a time, social distancing, that we're trying to have people stay in their homes, have people avoid crowds and avoid congregational areas where people go to meet. So it's all things that we are trying to do so that we can mitigate the spread of the virus and decrease the odds of spreading the virus in the community. So as you know, normally when we get an outbreak like this, it can peak very quickly. But then the whole idea of shutting down institutions and shutting down schools is to make sure that the epidemic curve stays very flat so that we don't overwhelm our health institutions with a lot of sick people.
At the end of the day, that's what we're all trying to do, right? We're all in this together. What's your advice on older people? Should we check in on them? They need food. We know we don't want to infect them, but what are your thoughts? We all have someone in our life who is in the high-risk group.
That's right. So I think we should be very intentional and use all the opportunities that we have to stop the virus from spreading to older people. You know, this virus, about 80% of people who get the virus will do very fine. But unfortunately, people who are older than 65 years old, people who are diabetics, people who have chronic pulmonary diseases, and people who have coronary artery diseases or heart diseases, or immunocompromised people. These are the people that the virus can really cause severe infection in these people. So it's very important that we take the steps. If you are sick, you stay away from the elderly, and if you're coughing or sneezing, you make sure that you don't go around people who are sick, because by going you don't go around these kind of elderly patients and these kind of people who are immunocompromised.
Well, Dr. Anyimadu, thank you so much. We appreciate your insight, and we thank you for your time.